Yes. Here is the card. Yes. Prepare your notes for this. 3 minutes or 5 minutes you prepare, no problem. In the test you will have 3 minutes to prepare. Yeah. Yes. Joining from my mobile. Yeah. Yes. So try to think about make some notes, rough notes. Yeah. Yeah. So there we are. We have 10 students on board now. So we are going to start this session. Yes. I'm joining from my mobile also. Yeah. I'm entering as Grandmaster class. I'll be operating from there. Yes. Right. So now there are some phases. There are some phases. What are the phases? Yeah. So who is there? I will ask somebody to type, or you can type there. Okay, whom can I talk? Yeah, I will only type. Yeah. Yes, I can ask. I can type here. Yes. Now we'll start with the introduction. Introduction. That is 0. 0. Yes, you can start the introduction. Write your own sentences there. How are you going to introduce yourself? Yeah. Write your introduction, please. Hello, sir. Is not right. It should be formal. Avoid saying hi, hello, hey. Avoid. Formal is good morning, good afternoon, good evening, good night. Use formal style. Dr. Swati. We have used hello, good evening. I'm Dr. Swati. Formal style will be like this. Good morning, sir. Good afternoon, sir. Good evening, sir. Good day, sir. Good night, sir. Good night, sir. Or madam, whatever it is. These are some styles of greeting. Come on in. Come on in. Please have your seat. I am one of the registered doctors. I am one of the registered nurses. I am the general practitioner. I am working in this general practice. I am your treating doctor. Write down all your sentences, whatever you want. Nah? All of you participate. It is nice to see you here. I welcome you to this hospital. Just giving some sentences. I'm just giving some sentences. So which sentence will be useful where, that you have to decide. I'm just giving sentences like that. Right. Come on, write down your sentences, please. Yes, good to see you. I am pleased to talk to you. If nobody has any sentence to write the sentence which I am telling. I am pleased to have you here. I am pleased to have you here. It is my pleasure to help you. How can I help you, sir? What brings you here? Would you please tell me the reason for your visit? Come on, write down your sentences. Don't wait for me. Don't wait for me. Write down as many sentences as possible. And note down all these sentences. I'll put them in your Telegram channel. Could you please brief me the reason for your visit to this general practice? What is bothering you? Would you mind telling me what is bothering you, sir? I would be extremely thankful to you if you can provide me some basic information regarding your name, age, and the purpose of your visit, sir, madam. I don't know what I'm telling. I'm just giving you different sentences, okay? How you're going to use them, that is your point. All of you activate your words, the sentences, write down. Huh? I have here in this case notes, in this referral letter, some details regarding your problem. But I would be extremely pleased if you can provide me the necessary information in your own words so that I can get a better idea of your present situation, sir. Yes. Come on, write down your sentences, please. Write down your sentences, please. Introduction only. The doctor has instructed me to discuss with you the various important measures like treatment, preoperative documents, and the other procedures. And the other procedures. Before commencing the actual discussion, I would like to know some very important information such as your identity, age, and the reason for your visit to this medical general practice. I can understand that you are a little bit upset and worried. So in the first place, would you mind detailing me the problems that are causing this situation? I want to listen to you. I want to hear about your problem in your own words so that I can understand the gravity of the condition, so that we can discuss the follow-up measures for your speedy recovery. Very good. Yeah, those are some sentences here. 55 sentences so far. Come on, write down. Participate, everyone, please. That's very good. Lot of sentences are coming. You can use them. Invite all your friends, as many of them as possible. Invite as many friends as possible. Sometimes the mistakes are there because of the artificial intelligence. I'm speaking speech to text. Maybe there will be some spelling mistakes that we can correct afterwards. You can take these sentences and copy paste, and you can take a printout of all these things. I'll put them in a book format, and I can give you of this letter, of this role play card. Now I want to ask you one thing. So what do you think about these points which I am telling you? Do you think that these are good for you? I'm speaking as it comes. I did not prepare any specific notes here. If you think that these are important, write about how important this is. Do you think that is least important? Just give 0%. So if you think average, it is 50%. And if you think it is best for you, don't give me grading. For you, if you think that these are very, very important, then you can give 100%, 0%, 25%, 50%, 75%, or 100%. You can grade these sentences, okay? Because these sentences, okay, you can use in your speech, right? Next. Now we are moving to the next part. That is, express concern that the patient has pain. Express concern that the patient has pain and views taking analgesic as a weakness. So the next question is here. Bullet point number 1. Bullet 1. So bullet 1. Express concern that the patient has pain and views taking analgesic as a weakness. So how are you going to discuss this one? Because the patient will be telling like this. Okay? The patient will be telling like this. How? Nurse. The patient will be telling like this. Nurse. I am Abraham Lincoln. I am Abraham Lincoln or Margaret Thatcher, and I'm 25. I am 25 years old. I'm working as an apprentice. Actually, I'm young and I'm learning work. You know, I have this pilonidal sinus, which is scheduled for excision the following week. Don't use the same words. Next week, the following week. I have quite a bit of pain, but you know, I'm embarrassed. I had an appointment with the doctor and he suggested me to meet you, nurse, and discuss with you the various treatment modalities. He asked me to discuss with you that you are going to explain me, you're going to educate me, you're going to counsel me. He asked me to meet you for counseling, education, and training, or to provide information regarding the treatment, the preoperative documents, and the other procedures that are going to be followed. Can you please, nurse, be kind enough and share the valuable information with me? This concerns my life, and therefore this information plays a very important role. The patient words also, you can use them. This concerns your life, and these suggestions are very important. Change the patient's words. Whatever the patient is speaking, also you can speak. Please explain me everything related to the problem. Why I am facing this problem? I mean, what are the reasons? There are many people, they do not have this problem. Why I only got this problem? What is the exact problem? Is there anything wrong with me? Or am I not taking proper care of myself? Please give me a complete picture so that I can take appropriate care. I can take appropriate care. If you explain me clearly, maybe I can understand what exactly is going wrong, so that in the future, I can prevent myself from taking these actions. I'm ready to implement all the suggestions that you are going to provide me, and be compliant with the recommendations provided by the doctor. So these patient words also you can use. You have to be compliant regarding the prescription provided by the doctor. Just to change it. There are some doctors who ask me, sir, this is nurse's card, sir. What should we do, sir, coming there? Am I teaching you only role play card? No, I'm teaching you how to make sentences. There is that doctor. What is this doctor's name? Dr. Swati Nemade. Why she is here? Dr. Swati is here. Hello, Dr. Swati. Are you here? Yeah, she is here. Yes. Dr. Swati is not crazy. Why is she here? This is a nurse's card. Dr. Swati is here. She is not crazy. She knows that Simon sir is teaching. That is very important. Even if it is for nurses, I have to come there. It is useful for me. Something I learned from there. Is that right, Dr. Swati? Was that your concept behind attending this session, which is, I did not say this is only for nurses. She's there. And there are many other doctors. There are many other doctors who are attending this session. But some people, they say, oh, reading, listening. This listening, we already know what is there to learn. We are doing a lot of practice. Practice. Why do we want to attend this session and waste half an hour of our valuable time? Simon sir is crazy, you know. He doesn't have any other better work. So he simply goes on teaching on the Zoom. Don't we have too much of work? We have better things to do. So they think like that. Don't. These are very important things. When I am here, I did not say nurses only class, right? I'm teaching you grammar. I'm teaching you vocabulary. I'm teaching you pronunciation. I'm teaching you quality. I'm teaching you sentence constructions. I'm teaching you many, many, many things. So don't miss the show when I'm online. These sentences are useful in the writing as well. Right. Now the nurse speaks like this. Bullet point 1, the nurse. This is the first paragraph, means the introduction. The nurse. So write written paragraph. There will be an oral paragraph. This is an oral paragraph. An oral paragraph. That means what you are writing in a letter, here also you'll be speaking in your role play card. You'll be speaking in your role play card. If you have a chance, take 30 seconds and invite, share this link with your friends, please. Let them come and learn. We're not losing anything. Today, not every day will be Sunday, okay? Today I'm giving you. Doesn't mean that you'll get these links every day. These are for my beloved children who study with me, who register the course with me, and who prepare with me. Okay? And every day we are not going to place it on the YouTube app. Okay? So today you can invite your friends so that they will be blessing you. Right. Now, the point is, the next question is here. Express concern that the patient has pain and views taking analgesic as weakness. Express concern that the patient has pain and views taking analgesic as a weakness. This is pronunciation. Express concern that the patient has pain and views taking analgesic as a weakness. This is a flat tone. There is some variation, some fluctuation. There is a magic in your speaking style. You have to impress whoever the person is with your style, with your command, with your presentation, with your pronunciation, with your vocabulary and grammar equally. Nonetheless, write down your sentences. You're all knowledgeable. No one is a not. Everyone is wise enough. Yeah. Good. Yeah. I am extremely bothered about your present condition. I can read from your facial expression that you are in immense pain, unbearable pain, extreme pain. I have no doubts regarding that. I totally agree with your concerns and worries. In fact, indeed, in reality, if I were in your place, I would also have reacted in the similar manner. You are not the only exception. There are many other people who are facing such a situation. It is quite common. Out of 100 people, almost 1 or 2 persons, individuals, suffer from this common ailment or sickness or disease or problem or difficulty. And everyone in the initial stages is worried about this problem. As a matter of fact, write down this sentence. everyone who is experiencing this problem feels in the similar way. As a matter of fact, gradually they will get accustomed to the situation. They follow the prescription provided by the doctor, implement the suggestions provided by the medical professionals, and are compliant with the medication, dietary and exercise regimens, and ultimately lead a normal life at par, in a similar way like any other normal individual. But the only exception is they are either taking medications or undergoing a procedure. Otherwise, they are equally fine. I'm just giving you some sentences. I'm giving you a number of sentences so that they will be in your brains, and then you can keep them stored at the back of your brain, cerebellum. And then when you need it, it will come out, just like how it is coming to me. I don't recall anything, just I'm speaking like that. Even the patient's words you can use. Sometimes he say, I'm very much worried. Then you can say like this. Your worry is understandable. Your concerns are reasonable. I totally agree with your worries. So this is how a nurse can respond. The next. Many students were asking me, sir, give me tips. Okay, and they don't attend the session. Yeah. There are some students who ask me tips. They don't attend the session. But see, there are doctors who are attending the session. Dr. Nida Imdad. Okay. Dr. Nida Imdad is a doctor. She's attending the session. She did not say, I'm a doctor, why should I attend this session? She did not say. She's attending here. Yes. There are many other doctors here. I cannot name everyone here. Okay. So, right. Now let us see the next part. The nurse points. Then the patient's points. The patient will speak like this. Sometimes if the patient doesn't speak, you can speak in the manner of patient. You can steal his words and you can speak. Give less time for the patient to speak and you speak more. Don't overtake totally. I was actually totally embarrassed when I was talking to the doctor. He was detailing me all the procedure. He was explaining me the reasons why I face this problem. But at that moment, I was totally taken. I was nowhere. I was puzzled. I was embarrassed. I did not know exactly. I was confused. All different sentences I am giving. Don't think that this is one particular sentence. I was confused. I was puzzled. I was embarrassed. I did not know what was happening. By the time I realized, it took me some time. And I could not grasp what the doctor was actually telling. Nurse, therefore, at that minute, I was not paying attention to the doctor because of my worry, my confusion, my panic, and my embarrassment. What to do? I missed it. I lost the information totally. He was explaining me, but I was blank. I was totally blank because I missed all the information. I did not pay attention to what the doctor was saying because I was embezzled. I was perplexed. I was confused. I did not know what was happening at that moment. Everything was blank, and I could not catch the valuable information which the doctor was explaining. Nurse, can you please help me out? Is there any way that I can know about it? Can you explain me once again for me, please? Now I have come back to my senses. I realize the situation. I know that it is very important, this information. Why don't you provide me all this information? All these sentences you can use. I would be thankful to you, nurse, if you can repeat the information that the doctor has given me. I'm sorry to say, that minute, that time, I was nowhere. I could not catch any information because I did not know what was happening, So please, I'll be thankful to you if you can explain me. Nurse. Now the nurse's role. So many sentences, so many sentences, so many sentences. Assure the patient that you understand the embarrassment, but doctors and nurses are used to a huge range of medical issues. This is bullet point number 2, providing reassurance. Bullet 2. This is called providing reassurance. Providing reassurance. Assure means providing reassurance. First one is empathy. Second one is reassurance. Third one is providing information. Okay. Fourth one is again reassuring, comforting. Fifth one is giving information, providing information. Third one is explaining the background. Explaining the background of the situation. Yeah. Every time I see this patient, nurse is telling, Mr. Lincoln, Mr. Lincoln, Mr. Lincoln, Mr. Every other sentence, Mr. Lincoln. I don't know why they say so many times, Mr. Lincoln, or some name of the patient. Why so many times? You think the patient is forgetting his name? The beginning itself you take once, that's enough. Right. I understand the reason for your embarrassment. It is quite common. And we know this happens. When you are provided information regarding something which is totally new, you become dumbstruck. If I were in your situation, I would have also been in the same place, same situation, same condition, reacted in the same way, whatever. But we, the medical professionals, the doctors, the nurses, and other professionals, we are used to these things. This is one type of issue. We have number of problems, number of medical issues. This is just one. We face all these problems, We have seen a number of cases, all these problems. So we got used to them. So no need to worry. This is a common thing. You need not be worried about that. Relax. Nothing to be bothered much. No need to panic. Your concerns are reasonable. No doubt. Undoubtedly, undeniably, irrefutably, undeniably, undoubtedly, irrefutably, use these words. Such things are common. So, stop worrying, my dear. So now you can give your points. You can give your points. See, you also can do like this one. There is a button at the bottom. And when you speak, it is typing on its own. This is called speech to text. Why don't you use this so that your pronunciation may be refined? The artificial intelligence will catch your voice and you are dictating to the artificial intelligence and it will type the information that you are providing. And there you are. Just you're giving yourself a practice to speak. Learn various modes of learning. If you're pronouncing wrongly, it will type wrongly. So if it is typing rightly, that means your pronunciation is good. Why don't you practice your pronunciation? See, question mark is there, full stop is there, comma is there. See there. Why don't you use this? Question mark is taken. That means that when you are speaking in that accent, automatically is taking it as a question. So that your pronunciation may be refined. Will catch your voice, full stop. and you are dictating to the artificial intelligence. It is C, comma, you are putting a prayer. Wow. There's a button at the bottom. I did not say comma, it already typed. That means the way how you are speaking, the artificial intelligence catches you and puts comma, full stop, question mark, and everything. Why don't you use this? This. Going down. Okay. I'll give you some examples. How to improve your pronunciation. Yeah. What's your name? Where are you going? How are you? So the way how you're speaking is very, very important. Your pronunciation matters a lot. See that? What's your name? What's your name? Where are you going? The way how your tone falls up and down. What's your name? Where are you going? Okay. So very, very important. See there a comma. So this is the way I think Kiran is using it now. Yeah. So you can use this and you can improve your pronunciation. If the artificial intelligence, text to speech, sorry, speech to text, it's able to catch your words and type correctly, that means your pronunciation is getting refined. Next. Explain that a pilonidal sinus is a small opening, a tract on the surface of the skin predominantly caused by an ingrown hair, exacerbated by sweat and prolonged sitting. Okay, that's bullet point 3. Now I have explained the introduction. I explained 2 points. Now you explain the 3rd point. Come on, activate. You write your sentences, please. That is the point number 3. Point number 3. Explain what is a pilonidal sinus. Pilonidal sinus. See. Sorry. Nurse. I'm very clean. I'm not dirty. I'm very hygienic. Sometimes, due to my work, extreme stress at work, I have lots of things to do in my office. So because of that, I feel tired and I shower in the morning and I have a bath at night. To tell you frankly, I'm very tidy, except in some rare situations. So don't consider me that I'm untidy. I want to tell you very clearly, nurse, I'm very systematic, neat, clean, and tidy person. I take bath every day, and all the acts of cleanliness I'll maintain. But of course, sometimes when I'm tired, I cannot take shower in the evening. So what I'll do is I'll take shower in the morning and I have a bath in the evening, at night. So you can consider me as being clean all the while. There is no doubt I neglect cleanliness. Now, this is the way how, I'm just giving you the way how you can speak. This much you can speak. I'm speaking for 1 hour. Can't you speak for 5 minutes? 5 minutes? Explain that pilonidal sinus is a small opening. Yeah. Of course, sir. My apologies. I think you have misunderstood me. I did not mean that you were not very clean or tidy or neat. If my words gave you a wrong message, forgive me with a big heart. But to tell you frankly, that's not what I meant. That is a total misunderstanding. Let me explain you further. This pilonidal sinus is a very small opening, a tract on the surface of the skin, very small, minute. Predominantly, especially caused by an ingrown hair. Ingrown hair. Grown inside. And exacerbated by sweat and prolonged sitting. It is not your own fault. It's not because you are not neat or untidy or not clean. It is a naturally occurring phenomenon. It is a naturally occurring phenomenon. Pilonidal sinus is a naturally occurring phenomenon. And you need not blame yourself as the reason for that. This is a quite common occurrence. So please do not consider this as your wrongdoing. Many people who are perfectly neat They also experience this problem. Now reassuring the patient. How you are going to reassure the patient? In these sentences, any sentence you can take some 7 or 8 sentences and you speak finished. 5 minutes. How many sentences are given there? Bullet point number 4. I beg your pardon, sir. I beg your pardon, sir. I'm extremely sorry. I did not mean that. I was not telling you that you are dirty. That's not what I intended to tell you. If my words gave you a wrong message, forgive me. But that's not what I intended to tell you. Actually, my essence was that this is a commonly occurring phenomenon. So you need not blame yourself for that. Some people who may be extremely clean also might get this condition. So don't take it on yourself that you are the reason for this. No. There are many ways to overcome this problem. You can implement the suggestions provided by the doctor. And I am also giving some education regarding how to manage your present condition to facilitate a faster recovery or healing process. This is in your hands. You can definitely overcome this problem, come out of this difficulty, help yourself to come out of this problem. Bullet point number 5. What am I supposed to do after the procedure? Nurse? What should I do? What are the things that I should do? What are the things that I should not do? And what should I do if some complications arise? Because I want to know well in advance so that in the future, if any such occurrences happen, if any such situations arise, then I can act according to your suggestions. Please provide me the information, all the necessary information, all the relevant information, so that I can keep them in my mind and implement them according to the situation. Now the nurse speaks. I'll give you some valuable information from now on how you are going to manage your condition. First and foremost, you have to notice or observe or check for any signs of infection or bleeding or bruising. If you notice anything such as this, you have to immediately report to the post-operatively. You have to be extremely careful first and foremost. Regular monitoring is very important. If you notice any signs of infections or bleeding or bruising, if you feel that it is more than you can manage, you have to immediately contact the relevant medical authority. I mean, the doctor or a nurse, and intimate them, discuss with them the problem that you're facing. Do not hide any information, because that may be hindering the treatment plan. You have to be open with the doctors, because unless and until you provide the total picture, the doctor can definitely not decide the perfect solution for you. So feel free to discuss the problem in its entirety, so that the general practitioner can understand the gravity of your situation, the seriousness of the situation. If and only if you provide all the information, then the doctor can give you appropriate treatment. In case any delay or prompt action is not taken at that particular time, this may hamper or hinder the healing process, and the recovery may be delayed or the period of recovery may be extended. Compliance with the medication regimen is of utmost importance. Do not ignore either taking the medications regularly or applying the antiseptic dressings at the scheduled times. Any sort of ignorance and negligence or not paying attention to the side effects or ongoing problems or signs of infection might deteriorate the condition further. And instead of a faster recovery, the duration of healing may be extended. So you can talk. I strongly believe, I vehemently believe that I have provided you with all the information that is required of you to handle the situation perfectly in the future. But in case any complication, unwarranted complication, unexpected problem arises, do not hesitate to contact the doctor immediately so that appropriate action may be taken. We are there to support you. Anytime you can contact, you can visit the health center. And share your problems so that we can solve your difficulties. Thank you for your patience and kindness for listening to us. So the way how you are presenting is very, very important. So many students, they think that we know everything of this. Okay, everything of this. Why should we attend these sessions? Okay, so do not miss any session when I am giving you, especially, okay, in the evening. Please do not miss. This information is related to reading, listening, writing, speaking, grammar, vocabulary, and pronunciation. So don't miss these particular sessions. Select all, copy, and everything will be posted in the yes. Yeah. See all the information. I don't know what we have spoken, everything is here. So from here, so this is the one. Copy, post link. Yeah, this is the post link. Telegram channel. All the information is there. Once this is done, I'll post it in the WhatsApp group also. I'll go to Telegram channel. Now, why should I post it? I don't know how many people are from how many groups. I don't know. In WhatsApp, you just go to Telegram channel and you can copy it from there. So we're done with the show. And what I expect is how beneficial was this speaking session for you. You can grade it from 0 to 100. Okay. If you feel that it is nonsense, you can give a 0, a big 0, 25%, 50%, or 70%, or 100%. If you say if it is 100%, and I'll try to give you more and more of these sessions so that on the day of the exam, you will learn everything and you can use it wonderfully well. And you can come out successfully and dance your happiness. Oh, these doctors are there for admission now. Admissions batch are filled up. Can you send your email ID so that I will send? Why? And send here a doctor from China. Okay. So now give your feedback, please. Provide your feedback in 1 or 2 sentences and a maximum of 3 sentences. Provide your feedback, please. Provide your feedback, please. Yeah. Hafsa, you were asking me, na? Hafsa, you were asking me, yeah. Yeah. You are the one who has to answer now. Ask me. Okay. Hafsa, where is Hafsa? Hafsa Jailani. Yeah, Hafsa. Wait 1 minute, I'll unmute everyone. All of you don't unmute, only those students whom I call the name you can unmute. Yeah, Hafsa, can you share your experience? You are asking Mina, sir, explain how to do speaking. Please, sir, explain me, tell me. I cannot tell individually, so this much I have given you. So how many sentences I have given you? You can make down the notes and you can use them, all these sentences. Yeah, share your Hafsa.
Yes, sir. Thank you very much. This it's very informative lecture, and we try to learn these sentences and use these sentences.
Okay. Yeah, Dr. Swati, you wasted your 2 hours in listening to the nurse's letter. Why? Can you unmute and tell what was the benefit you gained, if it is okay for you?
No, definitely not, sir. I have not rested. Instead, I got to learn so many quality sentences by this.
You are a doctor, na? You are a doctor. Why did you attend this nurses session?
Still, sir,
Wasted your time.
this is the exam of English, and it's same for all doctors and nurses.
Hope every doctor thinks like this and every nurse think like this. Na? Huh? So they say, sir, this is only for nurses. I don't know why, how they can judge that it is only for nurses. I don't know. And there are some nurses who say this is for doctors. No, this is English. English is common for everyone. Grammar, vocabulary, pronunciation, sentence, subject, organization, everything. Only the speaker is a doctor, speaker is a nurse. Other than that, what is that? Everything is one and the same. Yes, thank you. So, Simon sir will have to go for dinner. He has to order something and then he will have his dinner. And I hope, if possible, it's already 10 o'clock. I think we have done a good job today. I think maybe listening. If we take listening, maybe we'll concentrate, or shall we take tomorrow? Now, let me tell you, because listening, I want to take part C. Actually, I was planning to take part C at 10 o'clock, but the session has gone long. Okay, I did not even expect that much. So, listening session, part C, today or tomorrow. Yeah, give your voting, please. All the regular students who have registered, yeah, please give your voting. This session is only for the registered students. The speaking was open, but the listening text lecture will be only for the regular students. Do not share this link with any other group or friends, please. Because this is my hard work, okay? I cannot give everything free. Yeah. So let me see how many students have given today. So Kiran, regular student, Nida, doctor, regular student, Sajida, today, okay, ask me. New student, huh? Rajeshwari, regular student, okay, 4, yeah. Let me see. Maybe after half an hour or 40 minutes, let me relax a little bit because I have been speaking. Ashmita, yeah, I was thinking Ashmita. Yeah, Ashmita, can you speak? How was the session beneficial for you? If you're comfortable, you can share your experience like everyone is experiencing. No? You're a new student, no? You can share your experience. Was it useful for you? Why it is useful? Okay, you can just open your mic and tell 1 or 2 sentences if you are comfortable. Otherwise, you can write in the chat box. Sorry, sir, my mother-in-law. My God. Okay, Ashmita, you're outside, but still you're attending. That's really very great. Okay. Yes. So, maybe it will take at least half an hour for my dinner because I have to order now. So maybe half an hour, maximum 40 minutes. 30 to 40 minutes break. Directly, I cannot continue because I'm old man, not like you. Okay, young people. I have to give rest to my vocal cords. Otherwise, daily I cannot take class again and again. So I'll see after half an hour. Sorry. Yeah. So you can give your feedback and afterwards your feedback and leave for break. Sorry. Okay, good night, all of you. Have a nice day. Bye bye. See you again.